Curious about what mesalamine is used for? In this video, we'll dive into the typical uses, recommended dosage, potential side effects, and user reviews of this medication. Mesalamine, also known as 5-aminosalicylic acid, is commonly prescribed for the treatment of inflammatory bowel diseases such as Crohn's disease and ulcerative colitis. Not only does it help reduce inflammation in the digestive tract, but it also aids in maintaining remission and preventing flare-ups. With its anti-inflammatory properties, mesalamine works by targeting the underlying causes of these conditions, providing much-needed relief to those who suffer from them. However, it's important to know the recommended dosage and potential side effects before starting this medication. Our thorough exploration of user reviews will also help you gain insights into the experiences of those who have used mesalamine. So, if you're seeking accurate and comprehensive information about mesalamine, keep reading to discover all you need to know about this commonly prescribed medication. Typical uses of mesalamine. Mesalamine is primarily used to treat inflammatory bowel diseases, including Crohn's disease and ulcerative colitis. These conditions are characterized by chronic inflammation in the digestive tract, leading to symptoms such as abdominal pain, diarrhea, rectal bleeding, and weight loss. Mesalamine helps alleviate these symptoms by reducing inflammation and promoting healing in the intestines. In addition to treating active flares of IBD, mesalamine is also prescribed for maintenance therapy to prevent future flare-ups and maintain remission. It can be used long-term to help patients achieve and sustain a stable condition. Furthermore, mesalamine may be used in combination with other medications, such as immunosuppressants or corticosteroids, to enhance its effectiveness in managing IBD. Recommended dosage of mesalamine. The recommended dosage of mesalamine can vary depending on the form of the medication and the severity of the inflammatory bowel disease being treated. It is important to follow the instructions provided by your healthcare provider and carefully read the patient information leaflet. For mild to moderate ulcerative colitis, the usual oral dosage of mesalamine ranges from 1.2 to 2.4 grams per day, divided into 2 to 4 doses. The specific dosage may differ based on the brand and formulation of the medication. In some cases, a higher dose may be prescribed initially to induce remission, followed by a lower maintenance dose. For Crohn's disease, mesalamine is typically prescribed in a higher dosage compared to ulcerative colitis. The recommended oral dosage ranges from 3.2 to 4.8 grams per day, divided into multiple doses. The exact dosage and duration of treatment will depend on the severity and location of the disease. In cases where rectal inflammation is the primary concern, mesalamine may be administered in the form of rectal suppositories or enemas. The dosage and frequency of these rectal formulations will be determined by your healthcare provider, considering factors such as the extent of the inflammation and individual response to treatment. Potential side effects of mesalamine. Like any medication, mesalamine can potentially cause side effects. However, not everyone will experience these side effects, and most individuals tolerate the medication well. Common side effects may include headache, nausea, abdominal pain, diarrhea, and indigestion. These side effects are usually mild and transient, resolving on their own without the need for intervention. In rare cases, mesalamine may cause more serious side effects that require immediate medical attention. These can include severe allergic reactions, liver problems, kidney problems, and blood disorders. If you experience any unusual symptoms or side effects while taking mesalamine, it is crucial to contact your healthcare provider promptly. It is important to note that mesalamine has been associated with a rare but potentially severe condition called acute intolerance syndrome. This syndrome is characterized by cramping, acute abdominal pain, and bloody diarrhea. If you experience these symptoms, discontinue mesalamine immediately and seek medical assistance. User reviews of mesalamine. User reviews can provide valuable insights into the experiences of individuals who have used mesalamine to treat their inflammatory bowel disease. It is important to remember that everyone's experience may be different, and individual responses to medication can vary. However, reading user reviews can help gain a broader understanding of the benefits and potential drawbacks of mesalamine. Many users report significant improvements in their symptoms after starting mesalamine. They often mention reduced abdominal pain, improved bowel movements, and a decrease in inflammation-related complications. Some users also express satisfaction with the convenience of different formulations, such as oral tablets or rectal suppositories, depending on their specific needs. However, it is essential to acknowledge that not all user experiences are positive. Some individuals may not experience the desired effects with mesalamine or may encounter side effects that outweigh the benefits. It is important to discuss any concerns or questions with a healthcare provider to determine the most appropriate treatment plan for your specific situation. Mesalamine alternatives. While mesalamine is a commonly prescribed medication for the treatment of inflammatory bowel diseases, there are alternative treatment options available. These alternatives may be considered in cases where mesalamine is not well tolerated or does not provide sufficient symptom relief. For individuals with moderate to severe inflammatory bowel disease, immunosuppressant medications such as azathioprine, methotrexate, or biologic agents like adalimumab or infliximab may be recommended. These medications work by suppressing the immune system and reducing inflammation in the digestive tract. However, they carry their own set of potential side effects and require close monitoring by a healthcare provider. Corticosteroids, such as prednisone, can also be used to manage acute flares of inflammatory bowel disease. However, they are typically prescribed for short-term use due to the risk of long-term side effects associated with prolonged corticosteroid use. Other lifestyle modifications, such as dietary changes, stress management techniques, and regular exercise, can also play a role in managing inflammatory bowel diseases. It is important to work closely with a healthcare provider to develop a comprehensive treatment plan that addresses individual needs and preferences. Precautions and considerations when taking mesalamine. Before starting mesalamine, it is crucial to inform your healthcare provider about any existing medical conditions, allergies, or medications you are currently taking. Mesalamine may interact with certain drugs, such as nonsteroidal anti-inflammatory drugs, NSAIDs, blood thinners, or medications that lower the effectiveness of the immune system. Additionally, mesalamine should be used with caution in individuals with a history of kidney or liver disease. Regular monitoring of kidney function and liver enzymes may be necessary to ensure the safe and effective use of the medication. Pregnant or breastfeeding individuals should consult their healthcare provider before taking mesalamine, as its safety during pregnancy and lactation has not been definitively established. In some cases, the benefits of treatment may outweigh the potential risks, and alternative medications may be considered. How to take mesalamine effectively. To ensure the effectiveness of mesalamine, it is important to take the medication as prescribed by your healthcare provider. Follow the instructions on the patient information leaflet and seek clarification if any aspects of the dosage or administration are unclear. Mesalamine tablets or capsules should be swallowed whole and not crushed or chewed. If you are taking delayed release formulations, it is important to swallow them whole without breaking or crushing the coating. This allows the medication to be released slowly in the intestines for maximum effectiveness. If you are using rectal suppositories or enemas, carefully follow the instructions provided by your healthcare provider. These formulations are typically used at specific times of the day or before bedtime for optimal absorption and effectiveness. It is important to maintain the recommended treatment duration for rectal formulations to achieve the desired therapeutic outcome. Mesalamine FAQs. Can mesalamine cure inflammatory bowel diseases? Mesalamine is not a cure for inflammatory bowel diseases such as Crohn's disease or ulcerative colitis. It is primarily used to manage symptoms, reduce inflammation, and maintain remission. Can I consume alcohol while taking mesalamine? Moderate alcohol consumption is generally considered safe while taking mesalamine. However, it is important to consult your healthcare provider regarding any potential interactions or specific recommendations based on your individual circumstances. Can mesalamine be taken with food? Mesalamine can be taken with or without food. However, taking it with a meal or snack may help reduce the risk of gastrointestinal side effects. Can I take other medications with mesalamine? Certain medications, such as NSAIDs, blood thinners, or immunosuppressants, may interact with mesalamine. It is essential to inform your healthcare provider about all medications you are taking to minimize the risk of potential interactions. How long does it take for mesalamine to work? The onset of action of mesalamine can vary depending on individual factors and the severity of the inflammatory bowel disease being treated. Some individuals may experience symptom relief within a few days, while others may require several weeks of treatment before noticing significant improvements. Conclusion. Mesalamine, also known as 5-aminosalicylic acid, is a commonly prescribed medication for the treatment of inflammatory bowel diseases such as Crohn's disease and ulcerative colitis. It helps reduce inflammation in the digestive tract, maintain remission, and prevent flare-ups. The recommended dosage of mesalamine varies depending on the severity of the condition and the form of the medication. While mesalamine is generally well tolerated, it can cause side effects, and it is important to be aware of potential risks. User reviews can provide insights into individual experiences, helping to make informed decisions about treatment options. It is essential to follow precautions, consider alternative treatments if necessary, and take mesalamine effectively to maximize its benefits. By understanding the typical uses, recommended dosage, potential side effects, and user reviews of mesalamine, individuals with inflammatory bowel diseases can make informed decisions about their treatment journey.